Senator Rosen, I'm not going to say welcome to your committee, but I know we have before us Senate File 1098, 1098.
Thank you, Mr. Chair and members. Senate File 1098 is the drug price transparency bill. I do have an amendment, the A34 Amendment. Before I have Mr. Nauman walk through that, I'd just like to give a little preamble to the bill. It brings much-needed pricing transparency to this convoluted market for prescription drugs, and this will help patients make informed decisions and demand value from pharmaceutical companies. This is a bill that actually passed last year. It was in the conference committee and did not make it through because there was some controversy on some of the trade secrets. And where there's been much work on this bill going forward, Mr. Chair and members. For example, I just want to give a couple examples of price increases that we have seen just recently. Insulin has tripled since 2002, with the average price of insulin increasing 64% since 2014. Naloxone is hiked it, one manufacturer hiked it, the price by 600% over the last 4 years, from $575 to $4,100 a dose. Goboxone, to treat multiple sclerosis, brought to market in 1997, listed for $10,000 annually, and is now listed for over $90,000. Sovaldi, which is a cure, the first cure for hepatitis C, brought to the market at $84,000 per treatment. So those are just a few of the examples that we see going forward. Drug manufacturers are not subject to the same price transparency that hospitals and providers and health plans are. Then this bill deals with 3 categories of drugs: existing drugs, new drugs, and newly acquired drugs. We attempted in this bill to make it consistent with the requirements from other states that they are also looking at this drug pricing transparency. The reporting, and I really want to stress this, the reporting only takes place if the drug companies raise prices over the thresholds established in the bill. And the bill is based on the reporting laws currently in place in California, Oregon, Nevada, and Texas. There was significant changes made to the bill, as I said, such as raising the thresholds for generic drugs and removing some reporting requirements. The effective dates, of course, and the reporting dates have changed. So just a brief walkthrough, Mr. Chair, members, with the bill. And in Section 1, Subdivision 3, we start the reporting on the existing drugs. Existing drugs and newly acquired drugs will have the same reporting. It's the new drugs that are separate that have a different reporting threshold. And for existing and newly acquired, it begins October 1st, 2021. The reporting threshold for any drug over $100 for a 30-day supply, and for the brand drug if the price increases by more than 10% in a 12-month period, or more than 16% in a 24-month period, they have to report. For a generic drug, the price increases 50% or greater over a previous 12-month period, they would have to report. And as I said, for existing and newly acquired, the reporting information would have to show up at least 60 days after the price increase goes into effect. And they'd have to report the name and price of the drug and the net increase expressed as a percentage, the factors that contributed to the price increase, the name of a generic version of the prescription drug available on the market, the introductory price of the prescription drug when it was approved for marketing by the FDA, and the net yearly increase by calendar year in the prescription in the price of the prescription drug during the previous 5 years, the direct costs incurred by the manufacturer that are associated with the prescription drug listed separately, such as to manufacture the prescription drug, to market the prescription drug, including advertising cost, and how much to distribute the prescription drug. You also have to list the total sales revenue for the prescription drug during the previous 12-month period, the manufacturer's net profit attributable to the prescription drug during the previous 12-month period, the total amount of financial assistance the manufacturer has provided through patient prescription assistance programs, if applicable, any agreement between a manufacturer and another entity contingent upon any delay in offering to market a generic version of the prescription drug, the patent expiration date of the prescription drug, the name and location of the company, of course, if a brand name prescription drug that if a brand name prescription drug, the 10 highest prices paid for the prescription during the previous calendar year in any country other than the United States, and the manufacturer may submit any documentation necessary to support the information reported under this subdivision. The reporting for new drugs is different, but that does start October 1st, 2021. The thresholds have been raised, and that was a compromise that was and just for your information, this bill has been to judiciary. The reporting thresholds was raised from, for a brand drug, priced from the current definition of a specialty drug on a Medicare Part D to $670. It was $500. And for a generic, priced over the current definition of a specialty drug under Medicare Part D, it was $500, and we raised it to $670. But for the generic, it is not at least 15% lower than the referenced brand name drug. That was a new compromise that the stakeholders worked on. Reporting information is no later than 60 days after the new drug listed. And for new drugs, we need to know the price of the prescription drug, whether the FDA granted the new prescription drug a breakthrough therapy designation or a priority review. For new drugs, if the direct costs incurred by the manufacturer that are associated with the prescription drug listed separately, whether to manufacture the prescription drug, to market the prescription drug, including the advertising cost, and to distribute the prescription drug. For the new drug, the patent expiration date of the drug must be, if it is under patent, must be listed. And the manufacturer may submit documentation necessary to support the information reported under this subdivision. The research and development costs associated with a prescription drug that were paid using public funds also must be documented. And then the next subdivision 5 for acquired drugs in chapter, in section, subdivision 5 of section 1 is the same as subdivision 3 for existing drugs of section 1. So these reporting categories that are not in the bill any longer was the research and development costs associated with the prescription drug that were paid using public funds. Excuse me, I thought these, I'm sorry, I made a mistake. That should have been taken out. So that is not in the, okay, my apologies. For the newly acquired, for the new drugs, there's still a Mr. Chair and members, I did make a mistake. The research and development costs associated with the prescription that were paid by using public funds has been taken out of the bill. If available, the price as determined reasonable through effectiveness measures has been taken out. There's a public posting of information in subdivision 6, where MDH will review the information submitted by the manufacturers and post the information on a public website in an easily accessible and understandable format for consumers. MDH will then determine the form and format that is appropriate for public display. And then we get into the trade secret protection in subdivision 6. There is protection under the Minnesota Government Data Practices Act as well as the federal trade secret laws, and the commissioner shall not post to the department's website any information that is not public data under section 13.02 subdivision 8A or is a trade secret information under section 13.37 subdivision 1 paragraph B, or is a trade secret information pursuant to the federal trade secret laws under the Defend Trade Secrets Act of 2016. Another big concession by the stakeholders was the on lines 5.24 to 5.30, manufacturers are allowed to identify the submitted data considered trade secret and a rationale in writing. And if MDH disagrees, they will notify the manufacturer of this decision 30 days before posting that information. And then MDH will report the nature of any data withheld and the reasons for withholding the information from public disclosure. Subdivision 7 is a consultation where the commissioner will consult with a private entity or a consortium in issuing the form and format of the information reported under this section. It also allows the commissioner to consult with reps of the manufacturers to establish a standard format for reporting the information. Subdivision 8 is enforcement and penalties. Manufacturers who fail to comply will be fined $10,000 per day, and a manufacturer may be subject to fines for failing to submit timely reports or notices as required, failing to provide required information, or providing inaccurate or incomplete information, and any fines will be deposited into the Healthcare Access Fund. There is in Subdivision 9 a legislative report that MDH will provide by January 15th, 2020 on the Act's effectiveness in addressing the following goals: of promoting transparency in pharmaceutical pricing for the state and other payers, for enhancing the understanding about pharmaceutical spending trends, and assisting the state and other payers in the management of pharmaceutical cost. The effective dates is, the bill is effective August 1st of 2020, but the reporting for drug companies begins October 1st, 2021. So, Mr. Chair and members, that is the bill. I do have the A21 amendment before you that I'd like to incorporate an oral amendment to.
We have a phone to answer first.
I always
here.
know that's Senator Nelson's.
I'll be right with you. Senator Rosen, you do have the A21. It has been handed out, and to that amendment, you'd like an oral amendment?
Yes, thank you, Mr. Chair. On lines 1.14, it says at the very end that the second 98,000, an increase by 98,000 in fiscal year 2023 should be 68,000. I'd like to incorporate that into the A21.
And if you said what number?
There's 298,000.
Yep. The second.
Mr. Naumann, would you please explain that?
Madam Chair and members, on line 1.14, to conform with the pricing in the fiscal note, the second 98,000 at the end of the line should be stricken and replaced with 68,000.
Members, is that the amendment clear as amended orally?
And Mr.
Just
Chair?
incorporate that into your A21 amendment.
Thank you. And Mr. Chair, if I could have Mr. Naumann walk through the amendment. There was some.
Before we open it up for discussion, Mr. Naumann.
So, Mr. Chair and Senator Rosen and members, the lines 1.2 and 1.3 of the amendment are technical cross-reference changes recommended by council. Line 1.4 through the balance of the amendment are changes to appropriations made in the Health and Human Services Omnibus Bill. Paragraph A is adjusting a total. Paragraph B adjusts a subtotal down by $655,000 because it occurs in two places in the omnibus bill. It needs to be adjusted twice. Paragraph C adjusts the base for the same appropriation amount into fiscal years 22 and 23, which was the oral amendment that you just made.
Members, any questions on the amendment? The A21 amendment as amended.
And Mr. Chair,
Senator Rosen.
briefly again, this money has been sitting with the Department of Health from last year. The money was appropriated, so this is not new money. It has already been designated in their budget.
Seeing none, all in favor of the A21 amendment as amended, say aye.
Aye.
Opposed, same sign. Okay, Senator Rosen, your bill is in order. We'll open it up for discussion. Seeing Senator
Nelson.
Thank you, Mr. Chair. Senator Rosen, were you going to have some testifiers? If not, I just have one brief question then. And thank you, Mr. Chair. Senator Rosen, One, thank you. This has been one of the largest concerns of not just my constituents, but people all across our state, the escalating cost of prescription drugs. And so we know that sunlight can always help deter that type of thing. So I appreciate that. But I just have one question, and it's a kind of a generic question, I guess. So is there anything in this a kind of reporting or kind of, I wouldn't exactly call it price control, but reporting on price increases and comparing that with profits from the drug? Is there any chance, or this is what I would be concerned about, that we would inadvertently limit the funding of new drugs? In other words, sometimes you take the profits from one item in your inventory and you use those profits to invest in the next best thing. And so my only concern is that, but I don't want to see some unintended consequence that we would actually limit the development of the new drugs. Perhaps the drug that will cure Alzheimer's, or other drugs that we know are on the horizon. And so I'm just wondering if you could speak to that, one aspect a little bit.
Senator Rosen.
Thank you, Mr. Chair. Well, I think you said it very well, Senator Nelson, that healthcare costs are rising, and we need to get a handle on the reason why they're rising and increasing. I think even the president has got an initiative, and I was just looking for the name of it, and I can't find the name of it. I just looked at it this morning on the internet, but to get a handle on why these prices are increasing, and I truly don't believe there's anything that we're asking for that should make them nervous about disclosing. Transparency, there's nothing wrong with transparency. If there's a reason why we have a high-cost drug on the market, this will tell us why, and then the market will dictate going forward. And basically, there's nothing that in this bill that has got proprietary or information that's going to compromise any new research out there. So I feel very strongly that this is information that the consumer and we as policymakers deserve to have, to see why we've had these tremendous increases in our prices.
Just to follow up, Mr. Chair. Thank you. Oh, I definitely agree on the transparency. And I intend to support this as it moves forward today. I just would like some assurances, or to have you keep in mind as this moves forward, as it would come to the floor. Can a drug manufacturer use the profits from one drug, perhaps, to provide for R&D in a new drug? Developing new drugs is very expensive, and those are things that are saving lives. And so that's just the one caution that I have, is making sure that we don't inadvertently stipulate in some way that drug manufacturers cannot use profits to develop new drugs that are going to save lives. So the transparency is great, but as we look at reporting that, I think that's important. And I know you've protected the trade secrets. That's very important. But it also takes dollars to get those new drugs to market. And I want to make sure that we're not inadvertently stopping the development of new drugs that are going to change lives. Thank you.
Thank you.
Senator Rosen? Just a comment,
No,
guess.
yes,
just a
thank you,
comment.
Senator Nelson. I believe that profits are able
Members?
to be used in whatever direction they need to, absolutely, in this bill. There's nothing in here that says they have to be used a certain way or for new
Members,
drugs.
any other questions or concerns, comments to the bill? Senator Rosen, any final comments?
No, I think this is a bill that has been long overdue, and I'd like to just commend the stakeholders for this. This is a lot of collaboration around the table, a lot of meetings. This will be a Minnesota model where other states are going to look at this and go, this is a really good bill because of the collaborative nature by the stakeholders. We had many, one of my jokes was, one of our meetings was on Valentine's Day, and I said, I've got my jammies in the office. We'll stay here all day until we get this hammered out. And they all came to the table and agreed on something that I think is going to be a Minnesota model going forward. So with that, Mr. Chair and members, I move that Senate File 1098 as amended be recommended pass and sent to general orders.
Members, any questions? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Thank you, Senator Rosen.
Thank you, Mr. Chair. Thank you very much, members.
I get a little extra.
Senator Benson, Senate File 3019. I know you are pitch hitting for Senator Jensen, and no one knows this bill better than you and perhaps Senator Pratt and
Senator
Senator
Jensen.
So you're a very good substitute to the bill.
Thank you, Madam Chair. The Minnesota Insulin Assistance Program has two components. One is an urgent need safety net, the other a long-term safety net for Minnesotans who are insulin dependent. The urgent need safety net program lays on top of programs for the insulin manufacturers and sets a standard for those manufacturers. It establishes who is eligible for those programs, and for the initial 30-day supply, you have to not be on MA or Minnesota Care, not have access to insulin for $75 or less, not have participated in the program in the previous 12 months. You would then go to a pharmacy, attest to your status. The pharmacy may collect up to $75 for the 30-day supply, and the pharmacy bills the manufacturer for the cost of the insulin. The pharmacy then provides individuals information about public programs and other supports. The long-term insulin safety net, again, establishes standards for the manufacturer's programs that will be the base of the Minnesota Insulin Assistance Program. 400% federal poverty guidelines, again, not in MA or Minnesota Care, not eligible to receive health care through the Veterans Affairs Administration, not have access to prescription drug coverage with a copay of $75 or less for 30 days. If you're in Medicare Part D, you have to have spent $1,000 on prescription drugs and meet other eligibility requirements. The manufacturer processes the application. They can distribute the insulin to the pharmacy, or they can send it to the individual. The pharmacy may collect a copay of $25 to facilitate the receipt of the 90-day supply. The Board of Pharmacy will develop an information sheet, distribute it to pharmacists and pharmacies, and they will also monitor the program. If the manufacturer isn't in compliance, they can be assessed a $100,000 penalty. Small manufacturers of insulin, $2 million or less, are exempt from the requirement of creating a safety net program. And to the committee's attention, we do have a fiscal note. Let's see.
Senator Benson, you have 3 fiscal notes, and I will take your direction on those.
Madam Chair, if I could move the A34 amendment.
Senator Benson moves the A34 amendment, and members, the reason we have 3 fiscal notes, it was just a matter of timing. We could not combine all of them together. We didn't have enough time. Mr. Nauman, would you like to explain the A34, please?
So, Madam Chair and members, the A34 amendment that has been moved, just a moment.
Madam Chair?
I'm
Madam
sorry.
Chair, the first part of the
Senator
A34
Benson?
is a technical amendment, and the second part,
Senator Benson, hold on one second. Everybody needs the amendment.
Okay.
I think we're just about there.
So, Madam Chair, if I could, for general information for members, when the bill was re-engrossed coming out of committee, the amendments that were going to be considered by this committee got re-engrossed compared to what fiscal staff thought we were fiscal noting. So what you will see at the top of the fiscal note is a different number than what the amendment is numbered. So I will try to cross-reference those for you as we proceed. The fiscal note that complies with the A34 amendment is listed as A17. And there's a small fiscal effect of $250,000 from the Healthcare Access Fund for MNsure in fiscal 2020, and then a appropriation to the Pharmacy Board of $76,000 on this particular amendment in fiscal year 2021.
Senator Nelson.
Thank you, Madam Chair. Mr. Nauman, is that $76,000 also from the Healthcare Access Fund?
Senator Benson.
Madam Chair, the $76,000 is from the Healthcare Access Fund. And to clarify, members, on the A34, Senator Jensen had amended in committee, if you look at page 1, line 13, he had taken out $2,000, so it matched with the fiscal note. This puts back that $2,000, so we get a $250,000 squared-up appropriation. Staff did notice that the $250,000 was more than MNsure actually requested to do their portion of navigator training, and so in consultation with Senator Jensen, the remainder of that appropriated amount will be used for paying navigators as they assist people into the Insulin Assistance Program. And so the appropriation remains the same, but MNsure is given some flexibility for training, and if navigators do the work, this is extra work, they would be given a small stipend.
Questions to the A34 amendment? Okay. Senator Benson renews her motion on the A34 amendment. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Senator Benson.
Madam Chair, if I could move to the A36 amendment and.
Senator Benson moves the A36 amendment.
And Mr.
And
Nauman.
before you, let's make sure we have it.
Yep, and the fiscal note is drafted to the A32.
A33, that's right, in the fiscal note. Thank you. It says 33. Oh, A32, excuse me. Are we?
So the A36 amendment is drafted to the A32
A32,
fiscal
right.
note, or vice versa.
Let's just see what she was. Senator Benson to the A36 amendment.
Thank you, Madam Chair. This is a program review by the legislative auditor to see if the manufacturers are in fact meeting the responsibilities that we have laid out in this legislation. In consultation with Mr. Nobles, he gave us advice on the language in this amendment and then drafted the fiscal note reflecting no net cost for the work that he will do.
Okay, questions on the A36 amendment, members? Senator Marty.
Yeah, Madam Chair, Senator Benson, the amendment that, I don't have it in front of me, but the amendment that Senator Jensen had the other day when it was talking about determining eligibility, now there's auditors to find out whether the manufacturers are determining eligibility in a timely manner. Did the other version have anything more than determining in a timely manner? Because one of the concerns is that they're going to determine people, they're going to have guidelines that basically deny people access, even though we intend them to be covered.
Senator Benson.
Madam Chair, Senator Marty, there is another amendment for the board, I'm sorry, for MDH to do a satisfaction survey, but there is, the legislative auditor is only responsible for seeing if the eligibility was determined in a timely manner. Perhaps this is just a drafting oversight, but Mr. Nobles would be, to the extent possible, without going to ask an individual about their medical records, being able to see if eligibility requirements were being followed. Okay.
Senator Marty? Good. Okay. No further questions on the A36 amendment. Senator Benson renews her motion. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Senator Benson.
Thank you, Madam Chair. I have the A37 amendment.
Which is your last amendment, the
This is my
A33 fiscal
last
note?
amendment,
Okay.
and the fiscal note is drafted to the A33 amendment.
And
So
that
the
is being passed out
A33
right
fiscal
now.
note,
Yep.
A37 amendment.
Thank you.
Madam Chair.
Senator, or Mr. Naumann.
So, Madam Chair, on the fiscal note listed, the 33A that corresponds with the A37 amendment, the Department of Health identified $136,000 of additional responsibility. The amendment that's in front of the committee has that on line 2.16 and sets the base in conformity with the fiscal note of $80,000 in fiscal year '22, and beyond that, there is no additional cost, so that's listed as one time.
Senator Benson.
Thank you, Madam Chair. And the Minnesota Department of Health has been given a quality role in this, and so they will be tracking individual satisfaction, including hiring an outside vendor. And Senator Jensen has not seen this particular fiscal note, but the amendment that he presented in the Health Committee did reflect this intention.
Okay. Thank you. Questions on the A37?
And Madam Chair, for the
Senator
benefit of
Benson?
the committee, this is drafted to come out of, the fiscal note is drafted to come out of the general fund.
I'm sorry.
No, it's the healthcare access one, isn't it? Mr. Naumann.
Madam Chair, I can clarify that point. The fiscal note itself says the general fund, but the appropriation in the amendment is from the Healthcare Access Fund.
Thank you, Mr. Naumann.
Great. Okay. Senator Franzen.
Thank you, Madam Chair and Senator Benson. I know we heard this bill already in your committee in Health and Human Services Finance, and this wasn't part of the discussion, so I'm trying to understand. Just yesterday, we had some bills talking about using the healthcare access funds to directly take care of patients, and this, to me, I mean, can you explain how this takes care of patients? I know it's a satisfactory survey, but it doesn't seem to be direct services to patients. So I feel like it's a bit inconsistent with what we're trying to do with the Healthcare Access Fund, especially with the bill we heard yesterday, which is unrelated to this one, but where we can't use money from the Healthcare Access Fund for technology. And this seems to be in line. Thank you.
Madam Chair, and Senator Franzen is right. Yesterday, I had a bill that would limit transfers out of the Healthcare Access Fund for IT projects, and they would get put in an Odyssey fund. This is a limited appropriation to make sure that an insulin access program is meeting the criteria the legislature established. And so if you'd like to move that this money come out of the general fund, I think that's an appropriate debate for this committee.
Madam Chair,
Senator Franzen.
not having Senator Jensen here, I don't know if that's appropriate. I don't know what he would say unless you can potentially read his mind when he's not here. But it just seems to be inconsistent what we're trying to do, and I'm not sure which one is the right way or the other. But if we're going to be limiting transfers from the Healthcare Access Fund, let's just be clear, what's that bright line? Because this seems to be kind of in the gray area.
Senator Benson.
Madam Chair, and thank you, Senator Franzen. So I think the Insulin Assistance Program is an appropriate use because it is about getting medicine to patients. This would directly support whether or not they were getting that assistance. And if they're not, then we need to go get the money from the manufacturers until they comply.
Senator Nelson.
Oh, thank you, Madam Chair. Well, I think it's a good idea to not take these dollars out of the Healthcare Access Fund. And so I will take you up on that offer and offer an amendment that the funds come out of the general fund, not the Healthcare Access Fund.
So with that, Senator Benson, there is no money in the general fund for this appropriation.
And Madam Chair, as the Finance Chair, informing the committee if there is money in the general fund is appropriate. We chose the Healthcare Access Fund because we believed it was directly connected to something that assists patients access essential medicines.
And I tend to agree with you, Senator Benson. Senator Champion.
Thank you, Madam Chair. I'm not on any of the healthcare committees, and, huh?
You're lucky. You're lucky.
Oh, you're lucky, okay. And I'm not certain if we should be hearing this amendment here in this committee without giving the committee the opportunity to wrestle with this issue, because, I mean, of course, money, I mean, if there's no money in the Healthcare Access Fund and now they want to take it out of the general fund, that seemed to be problematic, and I think there's some questions around patient access and whether this is the appropriate way by which to do some of these things. I'm just asking if this is the right place for us to have this amendment.
Thank you, Senator Champion. Senator Benson.
So, Madam Chair, if I could ask Senator Champion clarification if we should have the 837 amendment or the amendment to move funds from the Healthcare Access Fund or the general fund, which amendment? Because the committee did see the 837, the program was before the committee as having been funded out of the Healthcare Access Fund. And so I don't think there was a lack of clarity that we would be using the Healthcare Access Fund. But I'm not sure which amendment.
Senator Champion.
Thank you. The A37, and it's my understanding now that initially it was drafted in order to come out of the Healthcare Access Fund, but it's my understanding there's no money in the Healthcare Access Fund. And so, am I correct or am I
Madam
off
Chair,
base?
Senator Champion,
Senator
there is
Benson.
money in the Healthcare Access Fund for this. There is money in the Healthcare Access Fund.
Do you know how much? Do you know how much, Senator Benson, at this point? We can find out.
Not off the top of my head, Madam Chair. I know, I let you down. Sorry, Madam Chair.
Senator Newman.
Madam Chair and Senator Benson, I think that it's entirely appropriate to take the money out of the access fund, and I would not support the motion to take it out of the general fund. I also would put on the record that I agree with the statements by Senator Champion that if this kind of a change is to be made, maybe I'll go back to your committee and change it. Thank you, Madam Chair.
Thank you, Senator Newman. Senator Benson.
Madam Chair, I appreciate Senator Newman's support. I would not accept an amendment to have it moved to the general fund. This directly supports a program coming out of the Healthcare Access Fund that is about patient access. This is about the quality of that program. And so I believe the Healthcare Access Fund is the appropriate source.
So, Senator Benson, just to be clear in my head, the A37 was discussed in your committee.
Yes, it was.
The fiscal note came back. We're taking it from the Healthcare Access Fund. Is that correct?
This fiscal note came back taking it from the general fund, but the language is drafted to the Healthcare Access Fund.
And your preference would be to have it come from the Healthcare Access
Healthcare
Fund?
Access Fund.
That's right. Senator Nelson.
Oh, thank you, Madam Chair. And so I appreciate this discussion, and my point is we just go to the Healthcare Access Fund, and for many things. And while this is related to making sure that we have low-cost, an emergency insulin program that works. I think this is more than a tangential relation. And so I will withdraw the amendment, but I do appreciate the discussion, and the discussion being that we've just, for all too often, we've used this healthcare access fund for many things, and it's our go-to place all too often for the legislature. I'm glad this connection is much more close than many that we have seen, and I would not want to do anything that would jeopardize getting the affordable and emergency insulin program in place. So with that, I would withdraw the amendment, my oral amendment.
Thank you, Senator Nelson, for the motion to withdraw your oral amendment. Senator Cohen.
Well, Madam Chair, a couple of things. I have a question for Senator Benson, but before I ask it, I realize Senator Nelson has withdrawn her amendment looking at the general fund, but just a cautionary note to members of the committee as we start debating what we should do in terms of various funds. I think if the governor's going to present his supplemental budget tomorrow, I think members will learn that there are some real concerns with the general fund that go significantly beyond where the alleged surplus is. And we're going to have to be very, very careful for the rest of the session, whatever kind of spending we do. So that's a cautionary note for whatever this committee does. We'll learn more about that, I think, tomorrow. But, Madam Chair, if I could just inquire from Senator Benson.
Senator Cohen.
So, and I've not jumped into this issue as such, but so understand obviously what you're trying to do and support what you're trying to do, to say the least. Does this in any way reduce insulin prices? Will that be the end result, or is that just a happenstance of what we're doing?
Senator Benson.
Madam Chair and Senator Cohen, this doesn't have any impact on the wholesale acquisition cost or what an insurance company would negotiate for. This simply lowers the cost where a patient would access it, and that is at the point of sale, and the manufacturers will be responsible for absorbing the cost of this program.
Senator Cohen.
So the effort is as much access as it is cost then?
And
Senator Benson.
Madam Chair, I think it's fair to say that if the cost is too high, then you don't have access. And so lowering the cost at the point of sale for a specific population who does not have coverage improves their access.
Okay, thanks.
Senator Cohen.
Thank you.
Okay. No further questions on the A37 amendment? Senator Benson renews her motion on the A37 amendment. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Senator Benson, that's the end of your amendments.
Oh, I'm sorry. I thought you just gavelled us done, the
I
837.
was just
Can I move the bill? I was ready to go.
further discussion on the amended bill. Senator Marty?
Yeah, Madam Chair, Senator Benson, I like overall the direction of the bill. I think it's a big step forward. I remain deeply concerned about a couple provisions, including the sunset. I think this, I don't remember now when it exactly happens, but it seems to me we get this program up and running, and then we sunset it. So that's one concern. Also, I think the co-pays, I don't think we reversed that, the one where we're paying $75 for the 1 month supply and the $25 for the 3 month supply in the other program. But I think that the $75 for the first month one makes it harder for somebody who's in an emergency need to get it. But I think overall, I very much appreciate, I think Senator Jensen or whoever put this concept together, that that while the manufacturers can, quote, run their programs, that they have to provide the drugs to these people at this price. I think that's very helpful, and I think it's going to ensure that people who are at risk are going to get it. So I think the bill is definitely a big step forward, though I do think we have to reconsider the sunset and so on.
Senator Newman?
Thank you, Madam Chair. Senator Benson, I don't pretend to understand your bill nearly as thoroughly as you do. My only question is there anything in this bill that you feel would have an unintended consequence of having insurance companies not be as nearly as cooperative as they have been with certain patients, with the intent of driving them onto this program and letting the manufacturers pick up the tab.
Senator Benson.
And Madam Chair, Senator Newman, thank you, because that's part of a broader conversation. One of the reasons we set the copay deductible coinsurance mark at $75 is so that if people had access to less expensive insulin, they wouldn't come to this program. Now, insurers could say, we're going to move insulin from a preventive medication or tier 1 drug and move it to another tier. But there is an IRS ruling, guidance, it's not a ruling, guidance that says insulin should be a preventive medication. And so there is some incentive in different types of coverage to keep insulin in that tier 1, in the preventive status, and therefore generally having a lower copay. So we hope that this, working in conjunction with other changes, will keep the insurance companies and employer-sponsored coverage honest about the need for insulin, mostly for compliance. The more a diabetic stays in compliance and has access to insulin to facilitate that compliance, the less cost they have in other areas of coverage. And so what we hope this does is that for those people who have gapped their insurance or don't know they're eligible for a public program, or if their coverage hasn't come down to a reasonable level that helps them comply, that they would have access to insulin until we could put some of those other things in place.
Thank you, Senator Benson. Thank you, Madam Chair.
Thank you, Senator Newman. Thank you, Senator Marty. Further questions? Senator Benson.
Madam Chair, I move that Senate File 3019 as amended be recommended to pass and placed on general orders.
On Senator Benson's motion, all those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Thank you, Senator Benson. We have one more bill, members. Senator Newman's Real ID, Senate File 3901. And the fiscal note is in your packet. You are ready, Senator.
Madam Chair, thank you. Members, regarding Senate File 3901, it's a Real ID modification bill, a very, very brief history of the bill to assist you. During the Min-Lars-Vitrus legislative oversight committee hearing last month, it was brought to our attention by DPS that they are pretty nervous about a backlog on Real ID applications that will occur as a result of the mandatory implementation on October 1st. Their concern is legitimate. I think the last figure I heard from the assistant director or assistant commissioner on this issue is that only 14% of people in the state of Minnesota have currently applied for their Real ID, and that the applications are already backlogged into, say, July. So they're really legitimately concerned about the fact that the backlog is going to overwhelm the system, and folks, our constituents, are going to begin applying for a Real ID to get on an airplane in October, and they're going to apply like in August or September, and they will not have their Real ID by the time they want to get on that airplane. So one of the thoughts is that we could ease the restrictions on the documents necessary to be presented in order to obtain the Real ID. And what we're finding is that there were folks were coming to get their Real ID with the documents that they thought they needed and being turned away because there was a glitch in the documentation. And so what we decided to do is, number one, just put out the word, and I've asked all senators to use your social media contacts to put out the word. If you want a Real ID, you should be applying now. Don't wait. get online and do the pre-qualification online. That is very, very helpful. And then the final piece is the bill that is in front of you, where we are trying to ease the restrictions on the documents that your constituents present in order to get the real ID without jeopardizing the integrity of the system. So we backed some of these documents off, and it's closer in compliance with federal requirements. The list of them, of course, is in the bill. I'm not going to go through them because this is a finance committee, but that's basically the genesis of the idea. Representative Hornstein is carrying this bill in the House. I am carrying it in the Senate, and the idea is that we want to try and move the bill as quickly as possible and get it on the governor's desk for his signature so that it can be implemented as soon as possible. And the DPS has told us that they think that it will take approximately 4 weeks in order for them to do the programming necessary to get the program working. Before I go to the fiscal note, Madam Chair, I do have an A6 amendment that I would offer at this time. The A6 amendment.
Senator Newman. Senator Newman moves the A6 amendment. Members, it is in your packet. Yep. You have it with you. And Senator
We
Newman
have it
to
in
the
our packet.
A6 amendment, yes.
Yeah, it's, the A6 amendment is a technical change regarding the effective date and reflects a request by DPS on the four-week time needed to implement the program. And we had previously tried to do that and in the first engrossment of the bill and missed in terms of the technical language that was needed. And so the A6 amendment now reflects a better draft of the implementation date.
Thank you, Senator Newman. Senator Limmer.
Thank you, Madam Chair. Senator Newman, your description of the amendment was to adjust a 4-week time factor. And what is that? Could you tell me what the 4-week time factor represents? Are we extending a deadline 4 weeks? What is it actually? What's the purpose of the 4-week
Senator Newman.
factor?
Madam Chair, Senator Liberman, I will try and answer, and if I miss, then DPS is in the room and they can correct me. But I believe that what has been requested of DPS is the effective date of the bill as to when folks would be able to come to the driver's license agents and present documents is not more than 4 weeks after the bill is signed. And the purpose is to give DPS an opportunity for programming changes within the DPS program. In other words, they would not be able to implement this immediately upon passage because they have to make programming changes, and they have told us that they need up to 4 weeks.
Madam Chair.
Senator Limmer.
Senator Newman, I remember the debate regarding Real ID for quite a few years. I was opposed to that. But we were told that there was no exceptions to the federal demands, that all states had to comply by a specific date. We were told that in the event that we would not comply, that they would refuse to allow citizens to fly on airplanes in and out of Minnesota. We were told specific deadlines had to be followed exactly. And now I hear that there might be some flexibility in those deadlines. Is that what we're asking for?
Senator Newman.
Madam Chair, Senator Limmer, no, I do not believe that we are talking about any flexibility in the deadline of October 1st. That is not what we're talking about. What we are talking about is the situation where our constituents go to the driver's license agents and present documents that are needed in order to obtain the real ID. We are changing some of the documents necessary in order to obtain the real ID. So for instance, I'll give you just one. Utility bills with two unrelated individuals on it currently is not an acceptable document, and we are changing that. And with good reason. There are all manner of folks who live together and have their names on the utility bills. Some are married, some are not. Some people are married and have different names. And so that is an example of an unnecessary restriction, at least in my estimation. So what we are doing is we are requesting that this bill be changed so that our constituents have an easier time obtaining the real ID that they want. And we are giving DPS an opportunity to make the necessary programming changes within their software so that they can begin accepting the documents that our constituents are showing up with. We are not changing any other date. We're giving DPS an opportunity to make the necessary changes.
All right, thank you.
Thank you, Senator Lumber. It's funny that you say that's Senator Newman, because I had several constituents that said they had to go back 4 times to get the information correct, to get their real ID. And that's a disincentive and onerous. Senator Kiffmeyer.
Thank you, Madam Chair. I support the bill because I think Senator Newman has presented it well, and this is a federal requirement, so Minnesota went above and beyond and made things more difficult for their people. But I think, Senator Newman, it's also important that the Real ID application can be initiated online. And when you initiate it online and you don't go into the office, you initiate it online, that very process of that application will help you to know what you need before going into the county office. And so a lot of folks, they're just used to just walk into the office, and yes, they may misunderstand. I think these things will be helpful, and the sooner they can be implemented, the better. But I think just for folks to know, go online, go through that process, initiate the application. It'll help you to know specifically what you need. Therefore, the one trip, hopefully, to the county office will get the job done instead of multiples. Thought it'd be helpful to know that.
Thank you, Senator Kiffmeyer. Senator Nelson.
Oh, thank you, Madam Chair. Senator Newman, I think this is an important step. I want to tell you what happened to me and see if this amendment might fix that, because I have a sense I'm not the only one. 2 weeks ago when I was home on a Friday, I had all my documentation lined up, my birth certificate, everything else, including my marriage certificate. I went in, got all the new pictures, everything that was done, got my information up there, and was told my marriage certificate, because my name is different, but now for 40 years I've been Carla Nelson, so all my other documentation was Carla Nelson. Nobody would know my maiden name. However, I was told that my marriage certificate did not suffice. And I had to turn around, and I haven't been home on another Friday, so I can take care of that. The reason my marriage certificate did not suffice was it was my marriage certificate from my church, signed by the pastors. It was not the marriage certificate by the county where I was married with the stamped seal. I think that's an important thing for women particularly to note, is the marriage certificate that you think is going to suffice might not. However, I think I would like you to consider, you might not be able to do it right here on the spot, but it seems to me if all of your other documentation is with your married name, in this case for 40 years, and you have a marriage certificate, it's a bit difficult to go back to the state where I was married. In fact, when I called them, they said, well, can you come pick it up? I said, no, I cannot come pick it up. Well, do you have anyone nearby that can pick it up? I said, no, there's nobody left in this state that is related to me that can come pick this up. So I would say that I'm probably not the only person this would happen to, and I would like to know if there is flexibility regarding the marriage certificate. And so I'll just throw that out there. And I have been thinking I need to put this on social media because I would hate for other particularly women who think their marriage certificate that showed their name change is going to be sufficient if it's their marriage certificate.
Senator Newman.
Madam Chair, Senator Nelson, you have perfectly illustrated exactly what I'm trying to accomplish with this bill. I will honestly tell you I don't know the answer to your question off the top of my head, but I can tell you that I will talk to DVS about it and see if your situation is covered, and if not, whether or not it be wise as far as they are concerned to make a change, and perhaps we could offer an amendment. But as to your specific situation, I don't know the answer to that question.
I think Ms. Stengel's on top of this already. Yes, she does. She has an answer.
Well, am I glad to see her? I didn't know she was even.
She's been behind you the whole time. Welcome, Ms. Stengel.
Thank you, Madam Chair and members. Lexi Stengel, Senate Counsel. I was just speaking with DVS, and under federal law, if you use a marriage certificate, it does need to be a certified issue from a government office. So I don't think there's flexibility to amend that in state law. I can go back and find that federal law and send that to you so you have it if that's helpful.
Senator Nelson.
Thank you, and thank you for the clarification. I realize we can't override federal law here, but I do think it's something that I will make sure that I put out in my social media, and I think we need to make sure that that is very clear because it actually wasn't clear as I went to the station. Thank you.
That's a good point, Senator Nelson.
Isn't staff
Senator
wonderful?
Madam Chair.
Senator.
So, Senator Nelson, you're going to try and convince everybody on social media that you're still a Nelson? Is that?
Thank you. Yes.
Good.
Everybody in this state
We were all
only knows me as
wondering,
Nelson.
Madam Chair, I think since the department is here, that on their website where you have documents, that explanation that it must be that in accordance with federal law, that should be put on your website, so when people are looking there for information, they don't think they have the right document. And as Senator Nelson found out, wasn't quite the right location for getting it. The other thing I think is the question that Senator Nelson, you brought up, maybe DVS can, because we may have people from other states, since Real ID is a national issue. In Minnesota, if you have a marriage license in a county office and the person, I guess I always think when you call into a bank and want to transfer money, they want to make sure it is really you. And one of the things and the whole purpose sometimes of the Real ID Act is to be assured that's the case. So handing out a certified copy of your marriage certificate, they want to be sure it's you asking for it, not a fake you, using that document to steal your ID, your identity. So I think there is a reasonable aspect here in regards to doing that. But what is a way, say, if another state could send it direct to DVS? I mean, is there some way that that can be done? And if you could take a look at that area and help folks out to get this done as efficiently as possible. Thank you, Madam Chair.
Thank you, Senator Kiffmeyer. Senator Nelson.
Oh, thank you, Madam Chair. And not to belabor this too long, I think we've got the right pieces in place, which is to make sure that it says it's got to be a notarized, sealed certificate. But I just would say, just to not make more work, yes, indeed, I was able to get that certificate mailed to me, but that was not their normal process. So all is good, and who would have thought I didn't have an actual marriage certificate for 40 years? So anyway, I want to make sure others aren't in that same position.
Senator Newman.
Madam Chair, to the fiscal note.
For a fiscal note of $32,000 that it's going to be absorbed by the agency, we've had a good discussion, haven't we?
Yeah, and the agency is going to absorb the cost. The agency is here if you have any questions regarding the fiscal note, but that's all I have on the fiscal note.
Thank you. But we do have the A6 amendment before us, members. And Senator Newman renews his motion on the A6 amendment. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Further questions on the fiscal note for Senate File 3901 or the bill itself? Senator Newman, final comments?
Thank you, Madam Chair. Members, just thank you for your attention. I think that this is an important bill for your constituents in trying to help them. It's also an important bill for DVS in trying to help them with the anticipated backlog. So I would appreciate your support. I believe this goes to the floor, Madam Chair.
Yes, it does.
So at this time, I would move Senate File 3901 as amended, be recommended to pass and be placed on general orders.
Senator Newman's motion that Senate File 3901 as amended be recommended pass and sent to general orders. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Thank you very much on your work on this, Senator Newman. Members, that was, we did pretty good, didn't we? We have two bills up tomorrow, Senate File 4073 and Senate File 3275. With that, members, we are adjourned.